When we look at the streets of our cities and the promise of our future, it might seem like business as usual. But behind the scenes, our attitudes are changing. And the direction of change is up to you. We are calling everybody to raise awareness. To raise awareness because the mental illnesses are part of an epidemic impacting more than 40 million in the U.S. each year.
When I talk about mental illness, I'm talking about the diagnosed bipolar 2, schizophrenia, bipolar 1, the major depression, there's so many. Once they're diagnosed by a psychiatrist, they need to be looked upon as a brain disorder.
I developed major depression, my first episode, in about 1974 as a medical student.
I spent most of my life, without a diagnosis, without even knowing that I had any kind of mental illness.
I've always known that something was wrong because I had these mood swings, but first of all, I knew nothing about mental illness. I just thought I was just not feeling right, or I would just have these waves of depression. They would come and go, but I never put the two together. And it wasn't until I was going into the hospital for the first time that I found out.
My mental illness really came out more with being angry and hateful and being smart alecky. Okay. I wasn't happy. Okay. I was definitely unhappy with my family and my position in the family. Okay, I wasn't treated the best of the 3 kids, and I just knew this is something that I couldn't tell anybody.
2008 is when I really finally got treatment. I had finally had enough of my illness. So you can go from 1994 to 2008 of an untreated manic depressant, which was the older term, severely bipolar 1. And I don't know how I made it out alive.
My mother definitely had major depression disease as at least middle-aged and probably earlier. Spur of the moment, we'd get into a car to go on a trip and she would just say, "I'm not going." Go back to the house and disappear into the bedroom for days. Never treated, never diagnosed.
My real mother took her own life when I was 3. My sister was 5. And it was a secret that was hidden from us until I went into the hospital for the first time.
I think that my mom suffered from depression. Although, she had all the signs, but I didn't know what it was. She would stay in bed most of the time or isolate herself. She lost 3 children at birth, and so that may have been a factor as well.
I ended up being homeless and not having a job, and I turned to my cousin. He was going to help me. And when I was over at his house for 3 weeks, and we moved everything I had that I had left of my life, which was a bed and a TV and my clothes that I'd amassed since this has all come out. And he says, "You're out of here." He tried to get me to, he says, "I don't like Jenna." He says, "This is wrong." He says, "You're sick." And so the next day he put me on a train and left all the rest of my stuff there. And I'm like, I don't have any vehicles. I didn't have the friends that I did who would let me use maybe a vehicle that might carry some of the stuff. So he says, "I'm just throwing it all away."
When I worked in the Seattle area, I I had an episode, and this is when my medicine all of a sudden stopped working, because it happened when I was taking medication and I got sick and I was hospitalized. And the situation around that story is I was in a bad car accident because of it, and they faxed my medical records to the wrong fax machine at my work, and my coworkers got a hold of it, and the office gossip got a hold of it. And I worked in a large company. I had over 600 employees, and my accounting department that I was in had like 30 employees. And she proceeded to tell as many people as she could possibly tell my personal story.
I would start a job and I would be in a hypomanic state, and I'd really crank out the work, and they think, wow, this is great, we're really pleased with your work. Then I'd have an episode of depression. And they say, what's wrong? You're not doing anything. And sometimes I'd end up getting fired if the hypomania didn't kick in soon enough, or the depression would at least go away.
Having had depression and being in college, it slows. A lot of times you can't take as many classes because you just can't handle them. One time during college, I was definitely depressed, and I remember calling home and talking to my parents, and they said, well, why don't you just drop out this quarter?
Depression has a lot to do with me being transgender and not being able to come out until I did, and and not being able to grow up in the way I wanted to grow up, and be in the gender I wanted to be, living that role. Okay, I had to be the boy of the family, the oldest boy of the family, and I was the one expected to take the garbage out, mow the lawn, wash the cars, look out for the cars, and I didn't want that responsibility. I wanted to be soft, and I have a sister, and we saw a lot that my father did, and I thought that I told her, I said, I don't want to be your brother. I want to be your sister.
I am so afraid of major depression, much more so than mania or hypomania, but there's never in, let's say, maybe I'll make it 7 episodes, counting 2015, never been a trigger. It's just one day I'm fine, the next day I'm waking up early, shaking in my boots, and not wanting to get out of bed, feeling this morning terror. I mean, it's, you heard me earlier, it's the worst of the worst feeling. I'd rather be shot, stabbed, have open heart surgery than have a major depression. No triggers, except once. And that's after my wife died in 1992, after an incredibly difficult heart operation. And it was actually a redo from an operation in 1973. And then I had 2 kids to take care of, and I have this theory, and it's in a book I'm going to talk about at some point, that people who've gone through a major depression and survived, when they have to have a challenge and get through that challenge, they step up to the plate and they succeed. They do it because they're so strong from having gone through a depression. So I had to find a nanny for my kids. I had to make my new office work.
So I've broken a number of bones, ribs, collarbones, that sort of thing. And the pain I've experienced, the physical pain, is nothing compared to the pain of depression. And the reality that I had at the time was that I honestly believed that my family would be better off if I was dead.
I did not want to face life anymore. And I literally had the thought of, please put me in a nursing home, feed me through an NG tube, if that's correct, because until I get better, I can't survive this way.
And I really just assumed that every kid growing up felt that way, that I didn't want to live, I didn't want to be here, I didn't ask to be born.
My last attempt at suicide was 7 years ago. I just slowly started taking morphine and taking OxyContin, not morphine at the time, but I was taking OxyContin, and I was taking baclofen. I still take baclofen muscle relaxer. I just kept taking that and sitting there, and somebody came by and said something to me. I don't even remember what they said, And I stood up and down I went, unconscious and not breathing. And so somebody managed to call 911, and the next thing I know, I'm in an ambulance, and I was mad. I wasn't mad at them. I was mad that I'm awake.
People are committed suicide and developing these diseases as teenagers, and huge bunch of suicides in medical schools. They're even setting up a program at UCSF for mentoring by professors with individual medical students. Huge amount of suicide in medical students because they don't know what's going on.
I remember feeling like, not only can I not endure this another minute, I can't endure this another second. It's just unendurable. And I thought I was raised in a very religious family. I'm not terribly religious, but I remember, as a child reading about Christ's agony in the garden. And that, I thought, wow, maybe that was what it was like.
My mania starts typically, first of all, it creeps up on you much more subtly. So sometimes I'll have to require Sue to tell me, hey, you're getting up. I used to fight with her, but she was always right. The first thing I do is I start speeding and do a little reckless driving. And I get on the 60s on Sirius and I turn that music up as high as it can go. Then the speech starts rushing, fast speech. And that's where a lot of people can tell that my personality is changing. And the ideas come so fast, like for different projects. Mm-hmm. Oh, I need to do this. Oh, I need to do this too, and I need to do this. And I got to the point where you take post-it notes, and they're all over my room to remember what I want to do. And I don't sleep.
I was really high, with mania. And, I had a really bad episode. I was 19. I actually had shared this with you about the car accident. I don't know what it is, but I'm going to have all this faith in God, and I'm going to prove how much faith I have by, risking my life. So I drove my car into oncoming traffic on Briggsmore, hit a lady. The manic episode continued. I believed I was someone else. I thought I was going to buy a car. The car situation got really crazy. Then I became so high and manic. I actually went back to my employment office where I'd worked. Oh, the story's so intense. Anyways, I made a mess in there. I threw stuff, and I was very belligerent. I mean, I was out of control. How can you explain it?
From 20 to 29 of being single, and even though I wasn't diagnosed with mania then, I was sexually nymphomaniac. I never felt ashamed. I have to admit, I never did risky sex like with prostitutes or gay men or anything. I did a lot of married women. And I made sure that I never wrecked a marriage.
I really believed what I was going through. Those delusions, which were very, at times I thought I was God. And that happens a lot with mania, but I believed it. I did. And I took it to many levels of, everything around me was all about God was talking to me. God was telling me to do this. God was within me. I was doing... And there was nothing to stop me. And I would sign my name during those times. My name became a different person, was Faith, Love, Hope. Yep. My first name was Faith, and my last name was Hope. And I mean, this is amazingly, thank God these are so far-fetched, but these are all documented. And in fact, I was charged for breaking that police car window, and I was actually not brought up until later, when I was actually stable, and I got a speeding ticket, and the police officer looked at my record, and I guess I had a warrant out for my arrest, and I had 2 years of stability now. I'd actually gone to school and, started working. I actually got a license to be a nail technician, and I had my own little thing, and I was really doing well. I was living with my parents, and it was for that day. And I just it's amazing how when you are stable, you can't even believe the stuff that you did. I mean, psychosis to me was complete no touch with reality, and you couldn't tell me like that what was going on wasn't real.
I had to overcome what I had just done to destroy my entire life. I made a fool of myself for 2 months in front of everybody I knew, pushed everybody I knew away, spent all my money. I had to claim bankruptcy. I broke up with my boyfriend. I had to move. I was so depressed, having to face, look at what I just did to my life. Look at all the things I did when I was sick. I embarrassed myself. I humiliated myself. How am I going to face these people if I run into them again? Like, what am I going to do? Like, it was devastating. I was in such a deep depression. I didn't want to eat. I didn't want to get out of bed. It was hard to go to work. I made myself go to work, and I'd come home and I'd go to bed early every night because I was devastated for months recovering from that manic episode. It was so severe.
Well, I could definitely recognize the difference between hypomania and depression. And I knew that other people didn't have to go through the rituals that I would go through with obsessive compulsive disorder. But I didn't, know why I had to do that. I just had to, and that was just the way it was.
When I got these major episodes of depression, or that first manic episode, the only thing I could do that was right for me and right for my patients was to disappear. Told my partner, saw my psychiatrist, he changed my medications, and I liked Scottsdale, Arizona because I have a lot of relatives. I would go there, find a nice hotel, and contact my psychiatrist every few days, and sometimes it took 4 weeks, sometimes it took 8. I had partners who would take call.
I started running away at 14, but I found that I was okay with the people on the streets, and I enjoyed them, and they liked me, and it was just something that I found was happy to me, was with people that just cared about who I was and not where I came from or what college I was getting ready to attend.
My daughter is bipolar, and she had been, at the time, running away to San Francisco. And I was working at the police department, and I thought the worst most of the time.
Now, anybody who's hospitalized by a reputable psychiatrist or internist requires hospitalization for these diagnoses. They need to leave the hospital on medications, and they need to leave the hospital with follow-up, and that follow-up is where things break down. Particularly for the indigent patients, the homeless patients, where they're just sent out after 3 days, even though they're psychotic, and they get no direction as to where to go for follow-up. It's one of the biggest cracks in our care of the psychiatric patients, particularly the seriously mentally ill that we've talked about before, which are mostly schizophrenia folks, with 50% of which don't even know they're sick, agnosophobia, and the other bipolar 1 patients who likewise don't believe they're sick and will never take medicine. So where are they going to end up? On the streets, in jail, cycle back and forth, and throughout the country there is no answer for these people.
One of the reasons that I think it's so important that we're doing this documentary is to end the stigma and the shame.
I think there's a tendency for people who have a mental illness to self-stigmatize, but I didn't feel that. I educated myself, I began reading voraciously about mental illness, and I took the NAMI family-to-family class.
They've now isolated 4 genes that are common in 5 diseases.
I'm always trying to be out there to educate people what it's like to go through this. We're not trying to upset anybody. We're not trying to confuse anybody. We're not trying to trick anybody. Okay, we're not bad people for the most part. Okay, we have our problems. We have mental illness too. And we're all looking for somebody to love us and accept us for who we are.
When I applied for school, and it had one of these check marks. Do you have any mental health, blah, 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 blah. And I was going to check yes, and I said, that's never going to work. You got to say no.
So what do you say to a person who's applying for medical school or a residency, and they now ask for, have you ever seen or been on medication for mental illness? What are we now telling people to do?
People who don't understand mental illness and what can happen to you when you're sick like that, they judge you and they think the stereotypical things like she's crazy or whatever they want to think.
I would try to get some, consoling from my friends by opening up, and I could just see the scared look in their face, and then I just became this person that was no longer something to them. I was more of a thing to stay away from.
I think stigma probably comes from ignorance, and ignorance breeds fear. People who have relatives or friends who have a mental illness generally have some understanding and sympathy or empathy for those who have the illness. Those who don't, all they know is what they see on the news, where someone with a mental illness has picked up a knife or something and is threatening to harm themselves or somebody else. And often there's a shooting involved and the whole thing ends very badly. For them to equate mental illness with violence, which, is not the case.
In the mid to late 90s, it was very okay to come out of the closet as gay, lesbian or gay. But we still can't come out of the closet if we're mentally ill.
If you're dealing with gender issues, you have to let somebody know. You can't hold it inside for so long because it'll make you sick, and it can turn some people psychotic. Okay, I think maybe there's a lot of men in prison who are there because they might have these feelings, and so they've tried to be the opposite of this, which is being a hypermasculine male.
There are still a lot of people that aren't getting help. And I think because it has come to terms where depression is almost a common thing now, that the stigma for it has decreased. But I don't know if the stigma for bipolar or schizophrenia has changed.
And when you don't have control over yourself and your actions and your thoughts, and you've completely lost touch with reality, it's hard to reach out to somebody and get them to realize this is your illness right now. You're not in reality, you're lost in your illness and you need to get help. It's hard to really grab them and pull them in and realize you need to get help.
Society sees any group of people that are different and treats them differently, stigmatizes them.
There's no reason to be stigmatized for it, and so I refuse to be stigmatized. And in fact, I was very open with people.
I guess I have achieved a lot in my life, the 3 degrees, and I was successful at different periods of my life in jobs that were tough.
People with these diseases are among the highest cognitive, intellectual functioning people out there.
Anybody who survives a major depression comes ready to bat.
I think the biggest piece of advice I would give is that you're going to need somebody to advocate for you, because when you're really down, you're not able to do that for yourself.
Your primary care doctor should be instructed to put maybe your mental health file into a separate e-records than your other.
I understand at first it's hard to start medications when you don't know how you're going to feel and what the side effects are going to be, but you have to look at the overall picture of how bad is what you're going through, how bad is the depression, how bad is the mania, is it worth trying a medication? And for me, I had no choice.
The non-medicine methods. And these are grouped under the word mindfulness, which is anything from yoga to Pilates.
On any mental illness, I would say just read up. Be as educated as you can on your illness. I know people take journal entries with their mood.
If you can't see a psychiatrist or a psychologist, and if you won't take medicines, and if you won't talk to a friend or a spouse, and if you won't stay on medicines, you're heading down the pike to suicide.
If you hear somebody who's talking about suicide, you don't really have to worry so much. Okay, when they stop talking to you is when it gets scary.
And make sure that as your family, that you're aware of signs and symptoms that are going on with your loved ones. You know, are they isolating? Are they all of a sudden not going to places? Like, you know, and don't just, you know, just cast it aside as something. I mean, you know, really educate yourself on warning signs of mental illness, because it is silent in many instances, and that's where it gets scary.
You know, in your 20s and 30s, which is the common time, kids are entering college, just leaving college, starting careers, and they get slammed with an episode of depression or mania. That could be an end game.
Ending the stigma is where it's going to change, because if we kept secret and silent about our disease, how are we going to get better? You can tell me all day long, you know, oh, get out of it. But if I came to your son or whoever and I told him I know what it's like, not only do I know what it's like, but I've been there, and we're just going to get through this whatever we can. And, you know, that's what we're hoping, is to have more peers reach out to each other and empower through the walk, through this documentary, because we can do so many fun things. The biggest thing that's helping the 6 of us right here is the unity of peers. We're all empowering each other. Dr. Golden, Jack, Jenna, Mary.